Knock, knock, knock. Can I come in? Hello there. My name is Maria Castellanos. I am an RN in the emergency department. How are you doing today? Not well? Alrighty. We'll see what we can do about that. But for now, do you mind if I look at your ID bin? Just want to check. Alright, everything matches my record. Can you state your name and date of birth, please? Perfect. Thank you so much. And do you know where you are today? Yes, you are in the hospital. Do you know what day it is today? Perfect. It is March. Do you know what time it is today? Lovely. It is the afternoon. So, why don't you talk to me about what's on your mind today? What would you like to talk about? So I see you're pacing. Is there anything that's making you nervous? You're not nervous, you're just feeling sad today? Is there a certain event that occurred that brought on this sadness? So you're saying it was recently your birthday. Is there a reason why your birthday makes you sad? Oh, it's the same day that your dad passed away. I'm so sorry to hear about that. When did he pass away? Was it this year, last year, 2 years ago? I'm sorry to hear about that. Were you two close? Were you close with your dad? He was your best friend, huh? Yeah, parents can be very special to us. So I see on your charts that you've been increasing your alcohol intake. Yeah? Would you say that you increased your alcohol intake before or after the passing of your father? Okay, go on. Alright. Well, here, why don't we, let's stop the pacing. Why don't you sit down with me? We could talk about it some more. So you're saying you've been feeling very sad lately. Have you ever expressed any feelings of suicide or hopelessness? Alright, so you're saying that you have attempted in the past before. Is this because you feel as though because your dad passed away, you don't have anyone else who's close to you? Alright, I see. And in your previous attempts, how have you attempted? Do you currently have any weapons in your house currently? Not right now? Okay, alrighty. Well, as long as you're admitted here, we've got nurses around the clock. So if you ever need anyone to talk to, or if you're ever feeling any types of feelings of hopelessness while you're here in the institution, we'd be very happy to sit down and chat with you. So you've got that with us. But when you're at home, I know you said you lost your dad and he was very close to you. Do you have any emotional support animals? Do you have another best friend? Oh, you have a dog? What kind of dog do you have? Oh, that's nice. Yeah. Yeah, I have a dog too. He's honestly one of my best friends. So I was gonna say, if you're ever feeling any hopelessness, your dog relies on you. You're also his best friend. So you gotta take care of him as well. Gives you a sense of pride, something to look forward to throughout the day. Yeah. So while I have you here, I would like to ask you a few questions regarding your alcohol intake. It's just going to be like a withdrawal assessment while you're in the institution. Perfect. So I'm just going to ask you some questions, and if you have any questions for me regarding them, please let me know. If you feel uncomfortable about any of the questions, feel free to stop me. We can talk about them. So currently, do you feel sick, like in your stomach? Are you feeling any nausea or vomiting? So you have puked today already, and this was in the morning? Okay, and is it usually just dry heaves, or do you actually throw up like fluid as well? mostly dry heaves, but this morning it was fluid. Alrighty. Mind if I take a look at your arms really quick? Just hand out your arms to me like this. Try to hold your hands still. So I do see some tremors. Let me just feel your hands again. So you are feeling a little bit sweaty. Do you notice that throughout your day you're mostly sweaty? Yeah? Okay. Do you currently feel nervous or any anxiety? That's understandable. The hospital can be an anxious place for a lot of people. Hopefully once you get to meet the staff a little bit more, like me, your physician, and a lot of the other unlicensed personnel, you'll feel more comfortable with them. Everyone is very non-judgmental here. You can always feel free to talk to us. And recently, have you had any itching or pins and needles in your feet or in your extremities, kind of like a buzzing sensation? Moderate itching, you would say? How long does this feeling last? Usually at night when you go to bed. So it feels kind of like burning or numbness. Alright, does that ever prevent you from sleeping well? So you wake up at night often. How many hours would you say that you're able to like sleep at night? So you aim for 8, but you get 6. Alrighty, well 8 is a good number for now. Hopefully we can increase that 6 to 8 while you're here. And regarding your auditory disturbances, is there anything that you're more aware of? Like, do you have any sensitivity towards sounds? You get frightened easily, so you're just very aware of your surroundings. Do you ever hear things that are not there, or does anyone ever tell you that you're like having a conversation with yourself? Sometimes? Okay. And what about your eyesight? Is that sensitive as well? Are there any visual disturbances that you have? Well, what I mean is like, has anyone, for example, ever told you that you're seeing something that isn't quite there? Yeah? And when does this usually occur in the day? Usually at night as well? Alrighty, yeah, usually the darker it gets, the easier it is to think that there are things that are not there. Luckily, we do have night lights in our room, so if you ever wake up at night, you do have the option to have some lighting in the room. And how about your head? How often do you get headaches? Do you ever get headaches? How many times a week would you say? 4 times a week? And is this headache feeling like a band around your head, or is it like a clustering near your eye, or maybe like a spiking? Like a band? Do you take any medications for these headaches? Just Advil sometimes? Alrighty. Do you know what dose you take for the Advil? Just over the counter? Do you by any chance know how many like pills you take? So 2? Alrighty. Usually when I get headaches, I also like to try essential oils. Have you ever had any of those? Oh, you use the peppermint one? Yeah, that one's really good as well. Peppermint and lavender seems to help me with headaches sometimes. Alrighty, well thank you for going through those questions with me. Did you have any questions with me regarding those? Alrighty, well, the next part of this interview is just going to be some educational pieces. So I just wanted to talk to you about some of the signs and symptoms that you may have while you're in the institution regarding alcohol withdrawal. since in your MAR, it says that you usually drink like 6 beers a day. So while you're here, some of the signs and symptoms that you might experience are just going to be headache, some nausea, the tremors in your hands, some anxiety, and it may escalate to any seizures. So we always like to advise patients that if you're going to withdraw from alcohol at home, to please seek medical advice so we can monitor and observe you for any of these signs and symptoms. Alrighty. So while you're here, your provider may prescribe you some supplemental vitamins and medications to help with this withdrawal process. So I'm just going to go through some of them. So one of the more common medications for substitution therapy is called benzodiazepines. And this classification of a drug is called an anxiolytic, which just means that it's going to decrease the anxiety that you're feeling while you're having these withdrawal symptoms. And benzodiazepines usually also help with those signs and symptoms like headache, tremors, nervousness. So your provider may start you off with this medication. We'll talk more about it when we see what he prescribes you, but just to keep in mind, some of the side effects may include some more headaches, some dizziness, maybe some speech confusion, and drowsiness. But this all occurs during that detox process, because usually when you stop alcohol, the signs and symptoms start usually around 2-day mark, maybe 2 to 4-day mark. And something else that may be prescribed to you is going to be folic acid, because usually when someone has a high alcohol intake, they are going to have a folic acid deficiency. And folic acid is very critical to our bodies because it is an antioxidant, and we want to decrease any of the oxidative stress that you may have in your blood, because drinking a lot of alcohol contains a lot of sugars and carbohydrates, so that oxidative stress increases in your blood. So the provider will most likely prescribe you some folic acid to combat that oxidative stress. And another point of concern when going through alcohol withdrawal is Wernicke-Korsakoff syndrome, which is a type of brain disorder due to a B vitamin deficiency. And again, it is common to have a B vitamin deficiency when you have an increased intake of alcohol content. So your provider may want to prescribe you with thiamine, because again, you want to combat the symptoms of this brain disorder, which includes confusion, loss of mental activity, some loss of muscle coordination, and this may lead to even more tremors and vision changes. So if you experience any of those symptoms, you can report those to me or to your provider. And lastly, another mineral that may be prescribed to you is going to be magnesium, since you said that you vomit frequently. Whenever you vomit all that gastric acid, you are losing a lot of magnesium content in your body. So you want to keep you supplemented with that. So your provider may also give you some supplemental magnesium medication. Alrighty, thank you so much for sitting with me today. The provider will be in shortly to see you. If you have any other questions, your call button is near your bed. Again, my name is Maria. Thank you so much. See you soon.